Are you ignoring the silent cries of your body, cries that could mean the difference between life and death? Right now, as you're watching this, somewhere in the world, a woman just dismissed her frequent nighttime urination as aging. A man shrugged off pinkish urine as dehydration. But beneath these everyday symptoms, something deadly may be growing. In 2024, over 82,290 people in the U.S. were diagnosed with bladder cancer, according to the American Cancer Society. It's now the sixth most common cancer in men, yet still one of the most overlooked. Why? Because the signs are subtle, often mistaken for urinary infections or age-related changes, until it's too late. But it doesn't have to be that way. Studies show that when bladder cancer is caught early, the 5-year survival rate can exceed 77%. The challenge is knowing what to look for. And that's what we're here to help you with. In this video, we're going to uncover 13 warning symptoms your body may already be showing you. Some of them might surprise you. Others might sound all too familiar. Either way, you'll walk away with knowledge that could save your life, or the life of someone you love. This is not medical advice, but a vital message from a health information channel committed to empowering you. 1. Abdominal pain. Persistent abdominal pain isn't always just about digestion. Sometimes, it's your body urgently trying to warn you of something deeper, something that doesn't go away with rest, medication, or time. A 2022 analysis from the Bladder Cancer Advocacy Network found that over 37% of patients reported unexplained lower abdominal pain as one of their earliest symptoms, yet most delayed seeking medical attention for more than 3 months. Bladder cancer-related abdominal discomfort tends to settle low in the pelvis. Unlike gas or bloating that comes and goes with meals, this pain has a stubborn presence. It often grows worse as the bladder fills or during urination, and some patients describe it as a deep, pressurized ache radiating through the pelvis. The culprit? Tumors pressing against surrounding organs or stretching the bladder wall beyond its normal capacity. As inflammation spreads, the pain may intensify, even without a full bladder. What's especially concerning is how this pain can mimic less serious issues like urinary tract infections or irritable bowel symptoms. But when this type of discomfort persists without a clear digestive cause, and especially when paired with changes in urination, it's time to act. Don't brush off that dull, nagging ache is just part of aging or stress. It could be the symptom that saves your life if caught early enough. 2. Difficulty emptying the bladder. The frustrating sensation of incomplete bladder emptying can signal that tumors are dangerously interfering with normal urinary function. Bladder cancer patients often experience urinary retention, where the bladder doesn't empty completely during urination, leaving them feeling like they need to urinate again shortly after bathroom visits. This incomplete emptying occurs when tumors grow near the bladder neck or urethra, creating partial obstructions, preventing normal urine flow. Patients may feel like they're still holding urine even after urinating, leading to frequent bathroom trips with only small amounts passed each time. Severe cases may progress to complete urinary retention, where urination becomes impossible and requires emergency medical intervention. This represents a urological emergency that can cause kidney damage if not treated promptly. This symptom often worsens gradually, starting with mild feelings of incomplete emptying and potentially progressing to severe retention. Patients may need to strain during urination or change positions to empty their bladder more completely. 3. Anemia and iron deficiency. Hidden blood loss from bladder cancer can gradually drain your body's iron stores, leading to anemia that develops so slowly you might not notice until it becomes severe. Chronic bleeding from bladder tumors often causes iron deficiency anemia, particularly when blood in urine isn't always visible. Anemia occurs because your body can't produce enough healthy red blood cells to replace those lost through bleeding. This condition develops gradually, allowing your body to partially adapt, explaining why symptoms may seem mild initially but worsen over time. Cancer-related anemia symptoms extend beyond simple tiredness. Patients may experience pale skin, brittle nails, unusual cravings for ice or starch, restless leg syndrome, and difficulty concentrating. This type of anemia doesn't improve with dietary iron supplements alone because underlying bleeding continues. Anemia can occur even when blood in urine isn't visible. Blood tests revealing low hemoglobin, low iron levels, or characteristic red blood cell changes can provide crucial diagnostic clues requiring immediate investigation. 4. Bone pain. Deep, persistent bone pain that seems to emanate from within your skeleton can signal that bladder cancer has spread beyond its original location. When bladder cancer metastasizes, bones are among the most common sites. Where cancer cells establish new tumors, particularly affecting the spine, pelvis, and ribs. This bone pain differs dramatically from typical aches and pains. Metastatic bone pain is often described as a deep, constant ache that may worsen at night and doesn't improve with rest or over-the-counter pain medications. Unlike arthritis or muscle pain, this discomfort seems to come from deep within the bone itself. The pain occurs because cancer cells in bones can weaken bone structure and trigger inflammatory responses. Patients may experience constant pain or notice it worsens with movement or pressure. Some describe it as a gnawing or boring sensation that's impossible to ignore. Bone pain from metastatic bladder cancer often appears in weight-bearing bones like the spine and pelvis, potentially accompanied by increased fracture risk. 5. Swelling in legs. Swelling in your legs or feet might seem completely unrelated to bladder problems, but research reveals this can be a terrifying late-stage warning sign. Leg swelling occurs when bladder cancer spreads to lymph nodes in the pelvis or when tumors block normal fluid drainage from the lower body. This swelling differs from temporary puffiness caused by standing too long or eating salty foods. Cancer-related leg swelling tends to be persistent, progressive, and may affect one or both legs. The swelling occurs because lymph nodes, which normally drain fluid from tissues, become blocked or damaged by cancer spread. This symptom typically appears in advanced bladder cancer cases, often accompanied by other alarming signs like severe pain or urinary obstruction. The swelling may start gradually and worsen over time, potentially affecting mobility and comfort. When leg swelling appears alongside urinary symptoms, immediate medical evaluation becomes absolutely crucial. This symptom can indicate cancer has affected blood vessels or caused kidney problems due to blocked urine flow. 6. Loss of appetite and weight loss. Unexplained weight loss and diminished appetite can be your body's desperate distress signal demanding immediate attention. Significant weight loss, typically 10 pounds or more without trying, occurs in many bladder cancer patients, particularly as disease progresses to advanced stages. Weight loss happens through multiple mechanisms. Cancer cells consume significant energy as they grow and divide, essentially competing with your body for nutrients. Many patients experience chronic pain, medications, or the body's inflammatory response to cancer. This symptom becomes particularly concerning when occurring alongside other bladder cancer warning signs. Unlike intentional weight loss from diet or exercise, cancer-related weight loss often happens despite maintaining normal eating habits or accelerates when appetite decreases. Appetite changes can be subtle initially, finding favorite foods less appealing or feeling full more quickly during meals. Some patients experience taste changes, making eating less enjoyable. Unintentional weight loss or significant appetite decrease without obvious cause warrants immediate medical attention. 7. Fatigue. Overwhelming tiredness that doesn't improve with rest might signal more than just busy lifestyle stress. Persistent fatigue affects many bladder cancer patients, often appearing as an earlier symptom that gets overlooked or attributed to aging, stress, or other life factors. Cancer-related fatigue differs dramatically from normal tiredness. This exhaustion feels profound and doesn't improve with sleep or rest. Patients describe feeling completely drained of energy even after minimal physical activity, with fatigue worsening over time rather than fluctuating. Several factors contribute to this exhaustion. Chronic blood loss from bladder bleeding can lead to anemia, reducing your body's oxygen-carrying capacity and leaving you constantly tired. Additionally, your immune system's fight against cancer cells requires tremendous energy. When fatigue persists for weeks without identifiable cause, medical evaluation becomes important. Cancer-related fatigue often affects concentration, work effectiveness, and enjoyment of daily activities. Don't assume persistent exhaustion is just aging or stress. It could be something far more serious. 8. Urinary tract infections. Recurring urinary tract infections might seem like a minor inconvenience, but for some, they are an urgent whisper from a deeper threat. A 2023 clinical study published in the International Journal of Cancer Epidemiology found that nearly 1 in 5 women diagnosed with bladder cancer had a history of repeated urinary infections in the year leading up to their diagnosis. Why is this so dangerous? Because cancerous growths inside the bladder can create hidden pockets, where bacteria thrive, areas that are difficult to fully flush out with antibiotics. These tumors often cause low-level inflammation that mimics typical infection symptoms, like burning, urgency, and frequency, even when no bacteria are found on lab tests. This leads to one of the most common and heartbreaking delays in cancer detection: misdiagnosis. In women especially, urinary symptoms are frequently attributed to hormonal changes or chronic cystitis. As a result, signs like hematuria, blood in the urine, are dismissed as infection-related when they may be your body's first signal of malignancy. If you've been treated for multiple UTIs in recent months, especially if antibiotics only bring short relief or if blood in the urine keeps returning, do not ignore it. Insist on further investigation. Ask for a cystoscopy. Your health deserves more than another prescription. Sometimes, what looks like a common infection is your body's desperate attempt to be heard. Listen closely, it could save your life. 9. Urine flow changes. Changes in how your urine flows can reveal terrifying information about what's growing inside your bladder. Bladder tumors can physically obstruct urine flow, creating noticeable changes in stream strength, consistency, and your ability to empty completely. These changes often develop so gradually they're easy to dismiss. Patients may experience weak urine streams requiring more effort than usual, lacking previous force. Some notice streams that start and stop intermittently or difficulty initiating urination despite feeling an urgent need. Advanced cases may experience complete urinary retention, where urination becomes impossible. These flow changes occur because tumors can grow near the bladder neck where urine exits, creating dangerous blockages. Men might initially attribute changes to prostate problems, while women may not recognize them as abnormal. Progressive worsening of urine flow, especially with other urinary symptoms, warrants immediate attention. Your urinary system should function smoothly throughout life, and significant flow changes deserve urgent professional evaluation. 10. Back pain. Back pain is one of the most overlooked yet potentially life-saving red flags when it comes to bladder cancer. While millions of people suffer from routine back discomfort due to posture or strain, very few realize that in some cases, this pain could be the voice of something far more sinister. According to a 2024 review published in the Journal of Urologic Oncology, nearly 19% of patients with advanced bladder cancer reported persistent lower back pain before their diagnosis. Unlike common muscle aches, this pain doesn't respond to rest, massage, or anti-inflammatory medication. Instead, it often grows worse over time, lingering like a shadow and radiating deep into the lower spine. Why does this happen? Because as bladder cancer spreads, it can invade the pelvic lymph nodes, or obstruct the ureters, the narrow tubes that carry urine from the kidneys to the bladder. This blockage can silently impair kidney function and create a constant dull ache, a sense of pressure in the flanks, or even sharp pain if the kidneys become inflamed. If you've been dealing with lower back pain that just won't quit, especially if it's paired with urinary changes, like blood in your urine, frequent urination, or urgency, it's time to stop assuming it's just aging or a pulled muscle. This could be your body's desperate attempt to warn you of something much more serious. Don't wait. Ask your doctor for a deeper evaluation. Because sometimes, the pain in your back is really a cry from your bladder. 11. Painful urination. When something as basic as urination becomes a painful ordeal, your body is broadcasting an unmistakable emergency signal. Painful urination affects approximately 30% of bladder cancer patients, creating burning or stinging sensations that can range from mild discomfort to excruciating pain. The agony occurs because cancerous tumors create raw, inflamed areas on the bladder wall. When acidic urine passes over these damaged tissues, it triggers intense pain signals. This pain typically occurs during urination rather than before or after, distinguishing it from other conditions. What makes this symptom treacherous is its similarity to urinary tract infections. Many patients assume they have a simple infection and may receive antibiotic treatment. However, cancer-related pain doesn't improve with standard infection treatments. When painful urination persists despite appropriate antibiotic therapy or occurs without fever or other infection signs, immediate further investigation becomes crucial. Don't let persistent pain become your new normal. Relief might require a completely different approach than you imagine. 12. Frequent urination. Your bathroom habits might be screaming for help, but are you listening? Frequent urination can signal that something sinister is growing inside your bladder. Research indicates that bladder cancer fundamentally alters urination patterns, forcing multiple bathroom visits throughout the day and disrupting sleep with nighttime urgency. This occurs because cancerous growths reduce your bladder's capacity to store urine comfortably. Imagine your bladder as a balloon. When tumors occupy space inside, there's less room for normal function. Patients often experience this both day and night, progressively worsening over time. What makes this symptom particularly insidious is how gradually it develops. Many people dismiss increased urination as aging or drinking more fluids. However, cancer-related frequency doesn't respond to typical remedies like reducing fluid intake. When you're suddenly making significantly more bathroom trips without obvious cause, your body might be sending an urgent distress signal that demands professional attention. 13. Blood in urine. The most dangerous symptom is often hiding in plain sight: blood in your urine. Research shows this appears in 80% of all bladder cancer cases, making it the most reliable early warning sign. But here's the terrifying part: the blood doesn't always announce itself dramatically. Sometimes your urine appears bright red or dark brown, impossible to ignore. Other times, the blood remains completely invisible, only detectable through laboratory testing. This microscopic blood can disappear for weeks before returning, leading people to dismiss it as temporary. What makes this symptom particularly deceptive is that it's typically painless. Cancer cells in the bladder lining are fragile and bleed easily. But without pain, many people ignore this critical warning sign. Whether visible or microscopic, any blood and urine demands immediate medical attention. Medical authorities emphasize that blood and urine is never normal at any age. Don't gamble with your life. This symptom requires urgent evaluation by a healthcare professional. Your body is always speaking. It whispers, it signals, and sometimes, it screams. The 13 symptoms we've uncovered today are not random inconveniences, they are your body's early warning system, trying to get your attention before it's too late. From subtle changes in urination to unexpected fatigue or lower back pain, each sign carries a message that could mean the difference between early intervention and a dangerous delay. Bladder cancer doesn't have to catch you by surprise. With awareness, with knowledge, and with the courage to act, you can protect yourself and your loved ones. Remember, early detection saves lives. And the first step to early detection is paying attention to the signs your body gives you, no matter how small or ordinary they seem. If this video helped you see things more clearly or gave you the nudge to take your health seriously, don't keep it to yourself. And if you want more science-backed insights, practical health tips, and life-saving information like this, make sure to subscribe to our channel and turn on the notification bell. Your health is your power. Stay informed. Stay strong. And we'll see you in the next video.